Dr. Alex Earle here, and it's Hump Day with Dr. Alex Earle. The time I get to spend with you guys and answer all your burning, yearning plastic surgery questions. And yes, you know it's coming from a reliable source because I am a Ivy League educated, Duke trained, double board certified plastic surgeon, and I've been doing this for over 12 years, all right? So I am happy to answer all your plastic surgery questions from head to toe. We can talk about pre-op, post-op, surgery itself, and anything in between, all right? But before we answer your questions, let's just give a little chat here on something that we get asked about a lot, right? So people come in, right? They invest all this time, all this money, all this, pain really that you're going through, the trauma of surgery, so that you can do your BBL, your liposculpture 360, with your Baser, your safe BBL if you're doing it here with us. And you've done all that, and now what, right? Because you don't want to go through all that again if you don't have to, unless you get greedy, right? But you don't want to go all through all that again, and you want to maintain those results for the long term, okay? So today we're going to talk about BBL maintenance and longevity, meaning trying to keep the results as long as possible. And I say as long as possible because unfortunately, of course, just like anything, it can't be forever. At the end of the day, age and gravity always wins, right? So you're not going to look the same when you're 80 as opposed to when you're 40. And you're not going to look the same, in your 40s as when you're in your 20s, right? At the end of the day, gravity and aging always wins. But we want to try to maintain these results as long as possible. All right, and just thinking about that, there's actually a couple of things here I even forgot to put in, which we'll get into. But one of them, we'll just put it in right now, is no major changes. Okay, don't get pregnant after surgery. All right, that's gonna, that's gonna obviously affect the results. Okay, so. After you get to your BBL, now what? Well, the first thing is your kind of what I would call immediate post-op care, or your post-op care within the first 3 months of surgery, okay? This is incredibly important. Those of you who have been following me for a long time, you always know that I always say that the post-op care is just as important as the surgery itself, all right? And if you don't follow up on your post-op care, a beautiful result on the table can get it can get actually completely ruined, okay, if the post-op care is not followed appropriately. All right, so what does that mean mainly? Well, first of all, it means no pressure, right? So we are putting that fat into the safe space. That safe space is between the skin and the muscle and that subcutaneous fat layer. That's the way that we do it here at Pure. We do it under ultrasound guidance. That's why we're recognized as a center of excellence for BBL safety. And that is the way that I think it should be done throughout the world, not just in Florida, not just in the US, but throughout the world, okay? And so when you do it that way, you have to be able to avoid pressure to the buttock and hip area. Now I know a lot of you guys are gonna ask, the question's gonna be, well, Dr. Earle, I went to Colombia or Dominican Republic and they told me I could sit right away. Well, guess what? The only reason they could tell you that is if they're putting the fat in the muscle, and that is highly, highly dangerous. That is when people can die, okay? So no, I do not recommend that. So you gotta do it safely the way that we do it here, and you're gonna put that fat in that subcutaneous space between the skin and the muscle, in that safe space, and therefore you can't put any pressure to the area for 6 weeks, okay? So that's gonna be 6 weeks of no direct sitting. You're gonna be laying mostly on your belly, and you also shouldn't be putting pressure on the hips, so no laying on the sides either, okay? If you're someone who's tried this, because some people are just not able to sleep well on their belly or sleep at all, then the next best thing is to have what's called like a cutout, like a mattress with a cutout in the center, or what they sometimes call a zero gravity chair, which is essentially a chair with a cutout, where then the bottom can kind of hang through the cutout, and then the sides are very, very soft so that there's minimal pressure in the hip areas, okay? So that's number one. That's going to be for 6 weeks, okay? Next, of course, is your compression. So you're going to be wearing your faha, right? Your faha, for the first 6 weeks, you're going to be wearing that night and day. And then after that, you're going to be wearing it 12 hours a day for an additional 6 weeks. And that's going to take you to the 3-month mark, okay? Why is the faha so important? So the faha helps Of course, it gives you compression. It helps the body remove or absorb fluid. It helps you with skin retraction. It helps shape the body. And it helps decreases risk of scarring or fibrosis, okay? But also importantly, not just the faha, what's really, really important are your massages. So I always recommend a minimum of 20, no less than 20. You're gonna start right away next day. You're gonna start your first massage the next day. The first 7 massages are gonna be daily. The next 7 are gonna be every other day. And then the last few massages are gonna be weekly until you get at least 20, okay? Massages are extremely important to remove excess fluid, okay? It helps also get the skin to retract better. It does help to reduce the risk of fibrosis and scar tissue. So massages are extremely important. Minimum 20, but then if we're getting into like the maintenance phase, then you can do more than that, right? You can do if budget wasn't an issue, if budget and time wasn't an issue, and believe me, I understand a lot of times it is, but if budget and time wasn't an issue, then you should get a weekly massage for the whole first year. That would be like the most ideal thing to do, okay? However, budget and time oftentimes is an issue, so like I said, no less than 20. Sometimes you can get a little bit more, maybe you get 30 or so. And the other things you can do is you can do self-massage. So if you're gonna do self-massage in the long term for maintenance, I recommend getting a roller. You can find these on Amazon, but if any of you have a question as to what roller to get, you can go ahead and ask us. We're happy to provide you that information. And so the roller is something that you can do yourself, right? So you don't have to go to a facility, you don't have to go to a massage therapist. You can do that yourself, and you can use the roller, and you use it on the trunk, use it on your back, on your sides. If you have stuff done on the arms, you can use it in the arms as well, or the thighs, okay? So that's something else that you can do, is do your self-massage with a roller, okay? So I do recommend that. So this is very, very important, especially within the first 3 months, in order to like really get the best possible outcome and to have, long-term results, okay? Next is gonna be your nutrition. Again, nutrition is important long-term, but it's very, very important, extremely important in the first 3 months, okay? That's the time where you're going to quote unquote feed the fat. So that means you're gonna be increasing the healthy fats in your diet, which are gonna be mostly like avocados, eggs, certain nuts like macadamia nuts. Also, if you like fish, salmon is the best one, your red meats. And if you need to though, in the first 3 months, and you gotta add some extra calories, just go ahead and have some ice cream and milkshakes, all right? Or you can have some of those Ensure shakes or Boost shakes, okay? But here's the key. The key for nutrition in the first 3 months is to not lose any weight whatsoever. So whatever your weight is at, baseline at the time of surgery, that is your new baseline weight. And for the first 3 months, you cannot lose any weight at all, not even a pound, okay? You want to stay at the baseline, or perhaps you gain a little bit, gain 2, 3, or 5 pounds. Don't get 30, all right? You don't want to gain 20, 30 pounds. That's overdoing it. But if you gain anywhere between 0 to 5 pounds, that's okay. And certainly not below the baseline. Super important, okay? After that, you're going to get into the maintenance nutrition, all right? So that's going to be more of a balanced diet. You should still add some of those healthy fats to the diet in the long term, okay? But the point is that you want to essentially maintain that weight, I would say within maybe 5 to 10 pounds of your surgery weight, okay? In the long term, you shouldn't go higher than 10 pounds, and you shouldn't go lower than 10 pounds. You want to be in that range, within 10 pounds of your surgery weight, in order to maintain your results as long as possible, okay? All right, next, exercise. So exercise is very important for the long term, okay? Certainly you're not going to be able to do any exercise in the first 6 weeks. That's the time where you're going to take it easy, only walking. So for the first 6 weeks, there's no heavy lifting, no strenuous activity. You're not going to the gym. You're not doing anything like that, okay? But that doesn't mean that you just stop doing it, right? After 6 weeks, you can start getting into the gym and you start doing exercise. So what kind of exercise? It has to be weight-based, Okay, weight-based exercise, meaning you're either using your body weight or you're using the actual weights at the place at the gym. Okay, that is what you want to do. And specifically for the BBL, squats are actually very, very good. A lot of people ask this question: can I do squats? Should I do squats? The answer is yes. You should do squats. Okay, squats are very, very good for BBL maintenance. Okay, so yes, highly recommend squats. Highly recommend weight-based type exercise. What I don't recommend is long cardio exercises. So for example, say you do your BBL, you love everything, and then all of a sudden you decide you want to become a marathon runner or someone that does half marathons or marathons. Well, I'm sorry to tell you, but you're just gonna lose it all. The hip dips are gonna come back, the buttocks gonna shrink up. So if you're doing those kind of long cardio type exercises, you become a marathon runner or 5Ks or whatever, there's a high chance that you're going to lose a lot of what you gained with your BBL. Okay? Which brings me to the next one, of course, weight control, right? So if you have a BBL and you have a certain look and you're very, very curvy and you lose, say, anywhere like 15, 20, 30 pounds, you're gonna lose that BBL, right? Once the fat settles, it's gonna act like the fat in the rest of your body. So when you lose weight, those fat cells are gonna shrink, and they're gonna shrink in your hips, you're gonna shrink in your buttock, and you're gonna lose that BBL if you lose a significant amount of weight. So I don't recommend losing much more than 10 pounds if you have the look that you like. So you shouldn't lose more than 10 pounds, and you shouldn't gain more than 10 pounds. You gotta stay within that range, otherwise your results are going to suffer. Okay? And then last but not least, what I was thinking, as we started this talk, is no major life changes. And most commonly what I mean about that is typically pregnancy. So, you have this beautiful result. If you get pregnant, things are very likely going to change, and you may need to do something afterwards. What I have seen most often actually with BBLs in our patients that have gotten pregnant after their BBL, if they did pretty well through the pregnancy, like they had a healthy pregnancy, they stayed active, they had fairly good nutrition, and they didn't overdo it, they didn't gain too much weight. You're gonna gain obviously the weight that you need for the pregnancy, but they didn't overdo it. A lot of times they bounce back really, really well. And the shape of the body bounces back really, really nicely, and the hips and the buttock, they bounce back nicely. Typically with them, what they have to change is then, of course, the skin and the belly and the breast, because that changes everything. So a lot of times our patients that have had a BBL that then become pregnant, they do come back, but they don't come back for another BBL. They actually come back for their mommy makeover, which makes sense. Okay? All right. So these are all the key things that you have to do to maintain that investment, because at the end of the day, it is an investment, right? You're investing in yourself, you're investing in your body, okay? You're investing in your self-esteem. And really, at the end of the day, that's what it's all about. So if you want to maintain that investment, you want it to be a long-term investment, well, these are all the things that you have to do, so that it can last for years and years to come. All right. Questions?
Okay. We're on fire, Doc. A lot of people.
A fuego!
A fuego!
All right, let's do it.
I like this one. Let's start with this. Is BBL smell real?
That is so funny that you asked that, because it came up, I think it came up, I don't know, was it TikTok or something? And obviously, who comes up with it? It was some dude, right? It has to be some dude. And the answer is no. Absolutely not. It is, can I say bullshit? It is bullshit. It is BS. Okay?
Okay.
It was just one of these fad things that came up on TikTok, and it spread a little bit like wildfire, but the answer is no. There is no such thing. I mean, think about it. Why would there be? We're using your own tissues, your own fat cells. Why would there be a certain smell related to that?
Have you ever done awake BBLs?
No, and I never will. So I don't believe in the awake BBL. I know there's a lot of people out there that would like to have that done. There's certain surgeons out there that do it. I think the results are inferior, to be honest. I think you can get less done, less aggressively, less shaping, and I don't think it's any safer, because that's the thing, right? People, it's advertising, right? Advertising, marketing, right? So their ad is that awake BBLs are safer because you're not undergoing general anesthesia. Well, let me tell you, when you look at the data, The answer is that that's, again, BS. It is not any safer to do in the weight BBL as it is to do one under general anesthesia. I actually think it's less safe because when you do in a weight BBL, you have to use lidocaine. That's the numbing medication that you use. And there is such a thing as a lidocaine toxicity. If you use too much lidocaine, it can affect the heart and it can affect the nervous system. So you can get heart attacks and seizures. Okay? So then that puts the surgeon in a tight spot, right? Say you give the amount of lidocaine you're supposed to give, but the patient's still having pain. What are you going to do? Well, if you give more lidocaine, you run the risk of heart attacks and seizures, so you're not going to do that. But the patient's still having a lot of pain, so you're not going to do the surgery the way that you want to do it because every time you touch the patient, they're jumping around and moving around, right? So then you're going to have an inferior result. No one's going to be happy. You don't know, I mean, I can't even count how many patients have come to me who've had a weight lipo or weight BBL and they're not happy with the results because they got minimal change because, you know, you just can't be as aggressive with it. So I think it's a waste of money and it's not any safer and they don't recommend it.
Could you please talk about what type of machine recommends for maintenance as well?
What type of machines? Okay, so yeah, I mean, obviously I didn't put anything related to machines really here. There are some, massage therapists out there who've been doing this for a long time who do recommend some additions to some of these protocols that may help. So one of them is ultrasound machine. Okay, not the same like the one I used for imaging. This is different. It's an ultrasound machine that you use outside in the clinic setting that you can use at the time of massage. And that helps with like blood flow. There's RF or radio frequency machines. The concept is similar to help with blood flow to the skin in the areas. You can also do what's called cavitation or carboxy therapy. And all these things have even though they work with different modalities, the concept is similar. So the concept is that if you can bring more blood flow to the area, that means you bring more oxygenation, more nutrients, more healing of the healing stuff, if you will. And so that then leads to a better result, softer, more supple skin, less chances of scar tissue and fibrosis. But I'm not going to give you any specific protocol. I think you should talk to your lymphatic, post-lipo lymphatic massage therapist for that.
I had a BBL done, but end with one flat side. Should I again wait to go second round?
Right. So there's going to be a couple options there. Okay, depending on what exactly is causing the flatness. So if the flatness is to lack of volume, then yes, I think a second BBL is a good option, especially if there's a significant amount of lack of volume. If the flatness is due to banding, cellulite, then possibly a way to fix that is with Ovally, which is a device that we have that fixes banding and cellulite. Okay. And then last, and this is really, really cool, we're probably going to be the first ones on the East Coast to have this. We're going to do this before the end of the year. If it's just a little bit of volume, guess what we're going to have now? We're going to have off-the-shelf fat. That's right. So fat that we can basically grab off the shelf and we do it right in the clinic setting. No need for anesthesia, no need for liposuction, and we can fill little small areas with that. That's really, really exciting. Stay tuned for that. It's going to be coming. We're probably going to be doing our first cases in December.
Okay. How long after a BBL can Ovally be done?
So if you're gonna do it after the BBL, you want to wait 3 months. Okay, so you can do it either 6 weeks before the BBL or 3 months after the BBL. Usually the next question is, can you do it at the time of the BBL? Only if you have very few, very well circumscribed lesions, right? You can't have like a whole bunch of cellulite everywhere to do it at the same time. But if you have, I don't know, anywhere from like up to 3 lesions on each side, or maybe some of the lesions are in the thigh area, not necessarily in the buttock area, then we can consider doing that at the time of the BBL.
I'm a vegetarian worried about not getting enough protein to maintain my results at the hips.
Yes, so you need protein, you need healthy fats, and so yes, I understand. So you're a vegetarian, so you can't really do, a lot of things like the salmon and the eggs and stuff like that. But hey, don't forget about your avocados. Okay, avocado. Some people call it, what do they call it? The perfect fruit, something like that. Avocados are awesome. Okay, they provide lots of nutrients. They provide a lot of healthy fats. And then if you do need, some supplementation, then look into like the vegetarian, equivalents of like Ensure or Boost or something like that to give you some extra protein and some extra healthy fats. So I know for sure that there's vegetarian or plant-based protein shakes. Because I take those myself. I take one of those every day, so that's a possibility.
Okay, how will those body type work for banana rolls?
Great question. Thank you for that question because a lot of women hate their banana rolls. Oh, well, first of all, what is a banana roll, right? So a lot of people are like, what are you talking about, banana roll? So banana roll is the roll fat that's just underneath the buttock in the back here, okay? So, you have the buttock and the buttock crease, and then that upper thigh, that junction between the buttock and the upper thigh, there's a little bit of excess fat there, and a lot of people call that the banana roll. And they want to reduce it, but here's the problem. If you do liposuction to that area, you end up removing the fat, but you also end up removing the support structure for the buttock, and then the buttock ends up falling down. Not good, very, very bad. And then you have this old, aged buttock look. The buttock looks 10 years older than the person, and that's bad, okay? So it's a lot worse than having a little extra fat there. So then what's the solution? Well, what can help, but without losing the support, is the use of body type. So body type uses a RF, or radio frequency energy. It helps tighten up that skin so that the skin gets a little bit tighter. The banana roll looks like it's less, but you're not doing like this liposuction there, so you're not messing with the support structure. So for banana rolls, that is my recommendation. Body type only, no lipo.
Don't forget to talk about BBL reversal, please.
Oh, yes.
I like that.
All right, we're gonna put it on the calendar. So next week, BBL reversal. Okay? All right, so stay tuned for then our next hump day. We'll discuss everything that has to be done, or everything that has to do with BBL reversal, which is a procedure that's growing in popularity. And we are one of the only ones to do it and do it well, because these are challenging procedures. They're not easy, but we've done quite a bit of them, and we're getting some good experience with that and some very good results.
How long do you like patients to wait after having a baby for surgery?
So typically at least 6 months. So 6 months after having the baby would be the minimum for any surgery, okay? And just keep in mind that if you're going to be doing a breast procedure, it's not 6 months from when you have the baby, but it's 6 months from when you stop breastfeeding. Okay, so any procedure 6 months after giving birth. For breast procedures, 6 months after you stop breastfeeding.
Okay. Okay, I'm a future patient of yours. How do I safely bulk up after a BBL? Can I do a slow and healthy bulk?
To bulk up after the BBL? Yeah. So, well, you're gonna wait, right? You're gonna do your post-op care. You're gonna do all that. You're gonna wait up until things are stabilized at 3 months. And then I assume you mean bulk up like in the gym, like building muscle. So after that, after 6 weeks, you can start getting back to the gym, but I wouldn't go too crazy, too excessive. Like you start kind of ramping yourself up. After 3 months, certainly then you can hit the gym a little bit harder, okay? And again, we do recommend those weight-based exercises. You're looking to bulking up in terms of muscle. That's totally okay, and you want to do squats and everything else. You should be able to do that and bulk up and build your muscle without really losing a lot of your shape.
Doug, is laser considered safer than traditional lipo?
The answer is none of the above. I mean, it's just as safe. There's nothing that really makes it less safe or more safe. It's an additional step to the liposuction, right? So in traditional liposuction, you have essentially 2 steps, right? The first step is you put in what's called the tumescent fluid. That's the fluid that has the epinephrine that decreases the amount of bleeding, and it helps kind of separate the tissues and makes the liposuction easier and less bloody. And then the second step is the actual liposuction, right? The actual putting in the cannula and sucking the fat out. When you use the vaser, you're adding the vaser step, an extra step. So with that, you do the tumescent part as you normally would, that's always first. And then the second part is using the vaser, which is also like a wand, like a lipo cannula. It looks similar to that, but it doesn't. There's no suction to it. What it does is that it emits the ultrasound energy, and that ultrasound energy helps knock off the fat cells. The technical term is called emulsify, so it emulsifies the fat cells, but it basically knocks them off from the surrounding tissue, so that when you then go to your third step, which is the liposuction, you're able to remove those fat cells easier, which means you're doing it with less inflammation, less bleeding, okay? And on top of that, you get better skin retraction because of the energy that was put in with the ultrasound. So it's equally as safe. Doesn't make things any more or less safe other than the technique of the surgeon, so it's the same. But I do highly, highly recommend it because even though it's just a little bit more time for me in the OR, it has great, great benefits of, like I said, less bleeding, less inflammation, and better skin retraction.
Is it possible for the cannula to poke important vessels or organs?
If you do it incorrectly, then yes, right? So that's why you want to go to someone who is double board certified, who has years and years of experience, who does things in a controlled setting, who goes to a clinic where they're not doing ridiculous amounts of volume at the expense of patient safety, someone who has, for example, the highest level of safety certification, which is the Joint Commission. I think you guys are getting the point here, right? You want to go to the right person in the right place, okay? Because yes, if you go to the wrong person in the wrong place, then the cannula can inadvertently do structural damage. It can poke organs, anywhere from the lungs to all the organs that are inside the abdominal cavity. It can poke major vessels, etc., which can lead to major, major problems and potentially hospitalization, ICU care, and death.
Can you please discuss a reverse tummy tuck combined with a BBL?
Right, so I wouldn't combine those procedures, but I think each of those procedures is a very good procedure, okay? If you're gonna do it that way, for the reverse, so first of all, what is a reverse tummy tuck, right? So reverse tummy tuck is when you're, instead of pulling everything down, you're pulling things up. So you're coming up this way, okay? Now, if you're gonna avoid the liposuction kind of in the belly area, or at least be very mild with it, then maybe you could do the reverse tummy tuck and then lipo the rest and then transfer whatever fat you have. But the problem is that here in Florida, we do have special rules here in Florida, which are different from state to state. And so when we do something like a reverse tummy tuck in Florida, then we're limited to being only able to remove 1 liter of fat via liposuction. And therefore, we're kind of limited to how much fat we can remove and how much fat we can add. It's only 1 liter to remove, and therefore, divide that in half, only 500 cc's per side to add back in. In other states, it may work out better. But both procedures are great, and you can separate them out. You can do your BBL and then your reverse tummy tuck, or the other way around, and you separate them out by 3 months.
Okay. And Doug, the last question.
Last one.
Yes.
All right.
Well, there's people recommending vegan protein. So
Yeah.
thank you. Yes.
There you go. Yeah, plant-based protein shakes. Yeah.
With the brand and everything.
The one that I use, and I'm not going to tell you it's the best one out there. I'm just going to tell you what I like. I use one called Sun Warrior, which you can look it up. I think it's great. But there's other ones out there, so yeah, check it out.
And last but not least, when can I take my faha out after a BBL?
So you're gonna wear it for at least 3 months. Okay, so for the first 6 weeks, you're gonna wear it night and day. essentially just take it off to shower, or if you need to go, an hour, 2 hour break, that's okay too. But then after that, you're gonna then scale down to 12 hours a day, and you're gonna do 12 hours a day between week 6 and week 12. Okay, and then after week 12, which is about 3 months, that's when you can stop with the faha altogether. Now, a lot of patients do that. Some patients want to continue to wear it for a little bit longer, and that's okay too. All right. I mean, yeah, that's one of the things. I didn't write here like long-term faha use. Some people do like to do that, and it's worked out for them. I think more than anything, it helps them to like not eat too much, right? When you're in that tight faha, it's tough to like have those 3 large meals and start gaining weight. So if the faha helps you in terms of nutrition and weight control, then go for it. Okay. All right. Okay, everybody. Well, this was great hump day. Next week, out of popular requests, we're going to be talking then about BBL reversal. Okay. Not a lot of people do this. We're one of the only people to do it, especially here on the East Coast. So if you want to learn more about that, make sure you tune in, okay? But I look forward to seeing all of you next week on Hump Day with Dr. Alex Earle. Ciao.